So what percentage of patients with advanced ovarian cancer get neoadjuvant? Let's just, I'm going to sort of see where this sort of, how many patients are there really that have an opportunity for surgery? Because she said there are some that don't. So what, give me a number. Neoadjuvant, what do you think?
50 minimum, 50%.
So let's say 50. So if you get neoadjuvant chemotherapy, you're not eligible for secondary cytoreduction, period.
Not by those criteria. Not by those criteria.
We have 3 studies which show that show no benefit in that, because you wouldn't have been eligible for desktop, and SOC1 and 213 said didn't work. So what percent are R0 out of the 50%?
Okay, so if we're talking interval debulking,
no frontline debulking, because
right, I was going to say you're excluding those for outright, right? So primary debulking, R0, 50%.
So now you're down to 25% that are at least eligible.
Are these fair numbers?
Huh?
These are smart people. Are these fair numbers?
Yeah, of course they are. I mean, I think it's so right out of the gate, 75% of the patients don't even talk about it because they weren't primary debulking and they didn't have an R0. And then what percent of patients are going to have a platinum-resistant recurrence? Because you have to have platinum-sensitive recurrence. Let's say 20%. Now you got, so you got to get rid of now you go from 25 to 20. And then what percent of patients are going to have sort of these isolated recurrences that you can resect?
Probably about a quarter, third.
Yeah, so let's say a third. So a third of 20 is about 5 to 10%. So that's okay. I'm not going to fight you.
That's okay. I think that's okay. See, I'm refereeing because you told me to. So I think that's okay because we're looking for the people who shouldn't have surgery, right?
Yes.
And so that's good algorithm to go through.
Yes. Thank you for that. But what happens, I'm afraid, is that, you know, when you're, as Dr. Desai, Dr. Randall's and our mentors, he always said that when you're a hammer, all the world's a nail. And when you're a surgeon, you're looking for someone to operate on.
He also said a good surgeon knows when to operate and a great one knows when not to.
Oh, I love that. Thank you. That's good wisdom. That's fantastic wisdom.